Hi everyone, welcome to week 8. This week we're going to be covering chapter 21. It is all about heparin infusion calculations. I think you'll find that this chapter is pretty easy to comprehend. Not a lot of new material. We're just specifically dealing with heparin because of its properties. Heparin is an anticoagulant. So basically what it does is it inhibits blood clots from forming or getting larger. So the doses for heparin are expressed in what we call units, USP units, and we administer this drug either subcutaneously through an IV infusion or through an IV bolus. On an actual label for heparin, we typically will see it printed in red on the label now because of the adverse effects. This is one of those drugs that is now on the ISMP list it just has tons of medical errors involved with it. If you have not seen my video in the weekly discussion post, make sure you check it out. It's the video about Dennis Quaid's twins and the heparin issue that happened when they were born. This is an example of the way heparin used to look. It's really important to check labels because of its potential for errors. And as you can see by looking at this, there are some very close similarities when looking at these labels. Similar colors, similar tops. And when you look at the strengths, again, if you're not paying careful attention to this, it can be very detrimental to the patient. Because, of course, once you start this process of thinning the blood or preventing clotting of the blood, it's very difficult to reverse. So, again, it's one of those drugs we really have to be careful with. So typically when we look at infusing heparin, we are being prescribed by the number of units. So there's several different examples in this chapter, but it really has to do with the patient's body weight and what the clotting time would be. So it's going to depend a lot on the patient themselves. So when you start watching that video with Dennis Quaid's twins, you'll see that, keep in mind they were neonatal twins. So in other words, they were very small. So that's huge when you look at the dosage involved with them. So they give you several examples and they show you using both ratio and proportion and using dimensional analysis. And as we talked before, ratio and proportion is usually the one that most people prefer. Here's an example. We're going to have a prescription for heparin to infuse at 1,000 units per hour, and the solution contains 20,000 units in 500 mils of D5W. So what we're trying to figure out is how many mils we're going to, or how many milliliters we're going to need to use to get to this rate of 1,000 units per hour. Keeping in mind that we know that it comes 20,000 units per 500 mils. So again, we're going to start with a question and what we know. So the question is 1,000 units is going to be how many milliliters? That's our question. And the way the medication comes is 20,000 units per 500 milliliters. And so your book sets up the ratio and proportion looking like this. So the given information on the left side, 20,000 units per 500 mils. And then what we want to know on the other side, 1,000 units is how many mils. And even though they set this ratio and proportion up with the colon, remember you can write this as fractions and then you're going to cross multiply. So that's where the 20,000x comes from. They cross multiplied. So 20,000x is going to equal 500 times 1,000. That 500 times 1,000 is then divided by the 20,000 to get 25 milliliters per hour. So again, I think most of you will find that the ratio and proportion method is going to be the most comfortable one for you. They do show you some examples using dimensional analysis, so if you do prefer that, you're welcome to use that method. But I highly recommend the ratio proportion method. If at any point you have questions this week when you're going through the material, please make sure you reach out to me. You may call, text, or email. My number is 618-792-2293. Have a great week.